Now, if we look at symptoms linked to inositol deficiency, as we mentioned before, fatty liver accumulation. So how do you know whether or not that's happening? One of the best ways is to ask your doctor to perform an ultrasound. An abdominal ultrasound can show your liver and show whether there's fat in it, and it's a way to do that without radiating yourself with something like a CT scan. So this is, again, just an easy test you can ask any doctor to order for you. We know that people that struggle with abnormal blood sugar, so if you are pre-diabetic, if your doctor's been told, or you've been told rather, by your doctor that you are pre-diabetic, that you are insulin resistant, if you've had blood tests where your glucose is higher, on average, higher than 90 in a fasted, this is a fasted reading, fasted state. If you've had a hemoglobin A1C test and your hemoglobin A1C is 5.7 or higher, these are all just, again, these are all just ways to know whether or not, you know, you have a problem. So again, if your doctor's told you this, again, insulin resistance, glucose over 90, hemoglobin A1C over 5.7, these are all ways, these two kind of talk to each other. These are all things that are linked to inositol deficiency. So there are definitely other things that can cause these issues, but inositol is one you're going to definitely want to have measured, possibly have it looked at. Now, depression and anxiety, also a symptom of inositol deficiency, as are abnormal menstrual cycles, especially women if you have severe mood changes during your cycle, if you have severe cramping, if you have headaches, if you have abnormally aggressive pain. These are all symptoms around the menstrual cycle that you might want to suspect inositol as being a contributing factor. And then as well, we have muscle cramping. As we mentioned earlier, inositol plays a role in calcium regulation, and this has to do with muscle cramping. One of the mechanisms behind why muscles cramp is actually calcium deficiency, or calcium inability to get to the right place to allow for contraction and relaxation. So muscle cramping, and this is again one of the reasons why abnormal menstrual symptoms. So this doesn't have to be menstrual cramping, but it could also be, you know, leg cramping, foot cramping, shoulder cramping, anywhere really in the body, eyelid twitching. A lot of people look at, you know, magnesium as a cause of muscle cramping, but it could also be very easily inositol. So several different symptoms associated. Now, what does the research have to say? What's interesting about inositol is that there are a number of research studies where they've actually done randomized controlled trials using inositol as a treatment for a number of different conditions and found inositol to be more effective than certain medications. And this is one example of that. If we look over here on the right, this double-blind crossover trial of inositol versus fluvoxamine, which is an antidepressant for the treatment of panic disorder. You can see here 70% of patients respond to current treatments for panic disorder. Many discontinue their drugs because of side effects. So this is kind of setting up why they were doing this study. Myoinositol, which is a natural isomer of glucose and a precursor for the second messenger phosphatidylinositol system, has previously been found superior to placebo in the treatment of depression, panic disorder, and obsessive compulsive disorder. But a direct comparison with an established drug has never been performed. So again, they were trying to compare the two, fluvoxamine versus inositol, in this study. And so that's what they did. They did a study on 20 patients where they completed 1 month of inositol up to 18 grams a day and 1 month of fluvoxamine 150 milligrams a day. And then they used something called a Hamilton rating scale for anxiety, and agoraphobia scores, and a clinical global impression scale. And what they found in the first month, inositol reduced the number of panic attacks per week by an average of 4, compared with a reduction of 2.4 with the drug Fluvoxamine. So in this case, 18 grams of inositol actually outperformed up to 150 milligrams of Fluvoxamine. Nausea and tiredness were more common with Fluvoxamine, so Fluvoxamine also had greater degrees of side effects. Because inositol is a natural compound with few known side effects, it is attractive to patients who are ambivalent about taking psychiatric medication. Continuing reports of inositol's efficacy in the treatment of depression, panic disorder, and OCD should stimulate replication studies. Okay, so basically 18 grams per day, which is a lot. You're not going to find 18 grams in a small pill. This is where you would use inositol. Probably have to purchase it in some kind of a large dose powder. Although if you're taking it in a liquid gel type of capsule, those are much more effective at absorption. But 18 grams a day, more impactful and more effective than the pharmaceutical Fluvoxamine without the side effects. That's the takeaway. That's the take-home message. So inositol helpful in that regard. Now in this study, this is just a study published, a review study on the pharmacodynamics of inositol, and I just wanted to point out here, you can see dysfunctions in the regulation of inositol metabolism have been implicated for several chronic diseases. Clinical trials using inositol in pharmacological doses provide amazing results in the management of gynecological disease, respiratory stress syndrome, Alzheimer's disease, metabolic syndrome, and cancer, for which conventional treatments are, to say the least, disappointing. So let's talk about what some of those other studies have to say. So if we look at this one, it's an update on the use of, so this is a group of OB-GYNs out of Italy that have been doing research on inositol. And so their conclusion, at least in this particular follow-up study, was gestational diabetes and congenital abnormalities of fetal central nervous system, such as neural tube defects, NTDs. You know, most people, we think of neural tube defects, we think of folate, which is vitamin B9 deficiency. So this is one of the reasons why a lot of the prenatals, a lot of OB-GYNs nowadays are recommending extra or increasing folate during pregnancy, because they can cause neural tube defects, but there are some women who are folate resistant. So they are resistant to its effect or impact, and what these researchers are finding is that in those folate resistant women, use of inositol is effective for the reduction or mitigation of neural tube defects. So you can see here, Myoinositol periconceptual supplementation prevents congenital malformation like neural tube defects, especially in folate-resistant women. We also have outcomes in gestational diabetes. So in this particular study, they were looking at kind of two things. They were looking at women who develop diabetes during pregnancy, as well as the outcomes of neural tube defects in the children. And so in this case, Myonositol is the second messenger of insulin, meaning it helps insulin do its job, acts as an insulin sensitizer, preventing the onset of gestational diabetes. So if you are a woman, so where we worry about gestational diabetes, if you're a woman and you're overweight before you get pregnant, if you're over the age of 35, and you have already a history of some blood sugar problems, maybe a diagnosis of prediabetes. These are just, think of these as just accelerated risk factors for going into pregnancy and a much greater risk of developing gestational diabetes. If that's you, talk to your doctor about using, it's Myoinositol is what MI stands for, Myoinositol. Supplementally. Now in a lot of these studies, they were using, you know, anywhere between 1 to 2 grams per day, sometimes as much as 4 grams a day. This is not the only study. I'm just showing you kind of a summary of things. But 1 to 2 grams a day or up to as much as 4 grams a day with folate, right, reduces the blood sugar elevation effects or gestational diabetes effects in pregnancy, but also reduces the risk of development of neural tube defects. So you see here a supplementation of Myonositol starting at least 1 month prior to conception and continued until 36 weeks of pregnancy is expected to prevent neural tube defects as well as gestational diabetes mellitus onset and its related negative perinatal outcomes as a side effects-free molecule at the usually administered doses. Myonositol therefore becomes a candidate for being one of the first tools to be used in preconceptual medicine. So won't hurt you to take it, but it could very well have profound impacts on the outcome of a pregnancy. What else is inositol good with? So check this out. So this study or review is a review of studies recently published in Reproductive Biology, Endocrinology. Inositol is an effective and safe treatment in polycystic ovary syndrome, a systematic review and meta-analysis of randomized controlled trials. So you see here it's a safe treatment in PCOS. Now what is PCOS? PCOS, polycystic ovarian syndrome. What is it? In a sense, it's diabetes of the ovaries. Just like if you've ever heard people use the term type 3 diabetes, which is diabetes of the brain. Okay, diabetes of the ovaries manifests as PCOS. A lot of times with PCOS, what happens? Women become infertile. So infertility is very prevalent in PCOS. It's very, very hard for a woman with PCOS to actually become pregnant or carry a pregnancy to term. So what did they find in this review, this systematic review of controlled trials? Inositol is an effective and safe treatment in PCOS. Moreover, inositol showed non-inferiority in most outcomes compared to the gold standard treatment of metformin. So what does that mean, non-inferiority? I mean it was equal in its power to help regulate blood sugar. Okay, why would we want to be cautious about using metformin as it relates to this, especially ladies if you're trying to have children, is because metformin can deplete these 3 nutrients. So if you're using metformin to control blood sugar, you have to watch out. It will lower your B12, it will lower your CoQ10, it will lower your folate. Now, B12 and folate deficiency are linked to birth defects. So again, if the whole premise of taking metformin is to try to control the PCOS so that you can bust your infertility and conceive, you're setting yourself up for problems nutritionally through that pregnancy. And again, this research review showed that inositol is just as effective in this regard. Again, doses ranging from 1 to 4 grams a day with little to no side effects at all, very high safety profiles. As a matter of fact, a number of research studies have shown inositol being very safe and lack of symptoms is in high as doses of 8 grams a day, and they've actually had studies where the doses were as high as 18 plus grams a day with no major or untoward issues. Now, beyond that, you see this study here, the effect of myoinositol on fertility rates in poor ovarian responder in women undergoing assisted reproductive techniques. So, okay, if you are a woman and you're going to see a fertility expert or fertility specialist and you're struggling to get pregnant, pay attention to this. So in this study, they were using 4 grams a day of myoinositol. And here's their conclusion. Our results suggest that the supplement myoinositol in poor ovarian responders significantly improved the ART outcomes such as fertilization rate, gonadotropin, ovarian sensitivity index, and significantly reduced the required unities of gonadotropin. Additionally, more extensive randomized control studies are needed. In essence, they found positive outcomes, more positive using inositol than not. Again, where there's no danger, there's no downside to using it. There's no risk of a problem, but the upside is tremendous, and that's really what you want to take away from that. Now, another one that is very problematic, a common disease that affects many, it's actually arguably, it goes between like the top 1 and 5 prescribed medications in the United States is thyroid medicine. Some years it's higher, some years it's a little bit lower depending, but hypothyroidism, as well as, so there's hypothyroidism, and then there's autoimmune hypothyroidism, which is also sometimes referred to as Hashimoto's. Very important to understand inositol's role in this, because there are a number of research studies that are now coming out and showing that inositol can actually improve TSH. So TSH stands for thyroid stimulating hormone. And in women that have low thyroid, or men that have low thyroid, TSH values are usually quite high. The reference range for TSH is approximately 0.5 to 4.5. But in somebody who's got hypothyroidism, oftentimes this number will be 5 plus. I've seen it in people sometimes as high as 25 or more. What researchers have shown, and what research is showing, is that using inositol, especially when you combine it with selenium, so myonositol plus selenium, actually reduces high levels of TSH. So it has a lowering impact. So it reduces TSH. So if you're high, it actually brings it down. The other thing that it's been shown to do is reduce TPO antibodies. If we look at one of the causes or signs associated with Hashimoto's, it's these antibodies called TPO antibodies, thyroid peroxidase antibodies, meaning you're producing antibodies. In this diagram here, you can see kind of inside of the cells of the thyroid, TPO, thyroid peroxidase, you make antibodies that attack it, and so then, it doesn't work. It's not capable of doing its job, and you need TPO in a lot of different functions. It's a very specific enzyme that helps, we'll talk more about it. Let's go ahead and do that. So in your blood, you have iodide, which is brought into the thyroid through this Syn-Porter pump, and then it's brought in to the colloid, which is the area of the thyroid gland where thyroid hormone is produced. And each time there's a different reaction that occurs. That reaction is called TPO, thyroid peroxidase. So it breaks that iodine down, or breaks that iodide down into iodine, because the thyroid wants iodine, not so much iodide, to make thyroid hormone. Remember, we're talking about thyroid hormone being T4 and T3. The 3 and the 4 represent iodine. And so, we use TPO to get from iodide to iodine, which is a very important part of this. So if you're making antibodies against that enzyme, you're not able to do that as effectively, and so therefore it's harder for your body to get iodine to attach it to produce thyroid hormone. We also, though, use TPO in a number of other areas. TPO is actually also used to basically to attach the different thyroid hormones. So if you look here, MIT, this is basically pre-thyroid hormone. It's a thyroid globulin, which is the thyroid hormone protein. So it's that with one iodine attached to it. And so what happens is there's this coupling response. That should be a G right there. There's this coupling response that occurs where we use TPO to combine two of these thyroid globulins that have iodine attached to them to produce T3 and T4. And so that's how we get there. And if we don't have adequate TPO, or if we have an antibody response against TPO, then that process is going to be hindered, and we're not going to make T3 and T4s adequately. Then your doctor wants to medicate you. And, what is T4 in terms of medication? This is that drug that oftentimes gets used, levothyroxine, sometimes referred to as Synthroid. those are artificial thyroid hormones, right? And so again, this is how thyroid hormone is produced. Now, if you have adequate inositol, if you look again, coming back up to this diagram, that's what this is right here, inositol, IP3. That's a form of inositol. And so you can see its role, we said earlier, in cell signaling as a secondary messenger. The thyroid hormone, thyroid stimulating hormone, is binding to the receptor, okay, and that activates this whole process. Well, if we have enough inositol will travel here to the endoplasmic reticulum, allowing for the regulation and release of calcium, which helps to make hydrogen peroxide. That's what this H2O2 is, and that's important for the production of TPO, which is involved, again, in making iodide into iodine. It's involved in producing thyroglobulin, and it's also involved in making T3 and T4. This is why inositol is so important for thyroid hormone function. So if you don't have adequate inositol, you could suffer here. And so all that being said, let's come back to the kind of the summary here, which is myoinositol has a determinant role in thyroid function in autoimmune diseases as it regulates iodine organification. What does that mean? That means we convert iodide and we turn it into iodine. That's what that process is referring to, iodine organification. And thyroid hormone biosynthesis by the formation of hydrogen peroxide and thyrocytes. That's this right here, hydrogen peroxide. You need iodine to get there. Okay, and so by doing this, you can make adequate T3 and T4. Now, going on here, depletion of myoinositol that is involved in the thyroid stimulating hormone signaling pathway may cause the development of thyroid disease such as hypothyroidism, and TSH levels are significantly decreased in patients with subclinical hypothyroidism with or without autoimmune thyroiditis after treatment with myoinositol plus selenium. So coming back to this, if the TSH is high, treatment with myoinositol lowered TSH and helped it to normalize. In this case, it was a treatment of myoinositol plus selenium. So combining those two nutrients led to a reduction or normalization from high TSH down to normalized or more normalized levels of TSH. So very important to remember that if you have hypothyroidism, you may have already been put on selenium. A lot of natural doctors are using selenium because the research shows that using selenium can lower thyroid antibodies, but a lot of doctors are not talking about this inositol role. So the role of inositol in thyroid, very, very important.